Hello, my name is Dr. Bernie Noe. I'm a naturopathic physician, and I'm here today to talk about the natural treatment of arthritis. Now, before I dive into specific treatment strategies, I'd like to spend a few minutes describing a real-life patient experience. Colleen came to my office with the chief complaint of severe arthritis. She described her joint pain as excruciating, a 10 on a scale of 1 to 10, primarily in her knees, hips, and ankles. In addition to that, she reported significant fatigue. She just said that her energy level was a 3 on a scale of 1 to 10, and that she was depressed. On a 27-point depression scale, she scored an 18, which qualifies as moderately severely depressed. In addition to that, she was also experiencing asthma and attention deficit disorder. It became clear in my conversation with Colleen that she was experiencing problems with blood sugar regulation, and that was probably contributing to her pain. So she began a low glycemic eating plan, which involved eliminating added sugars and significantly restricting grains in the diet, instead focusing on fruits, vegetables, and proteins. I also asked her to start cod liver oil and vitamin D. And when she returned 3 weeks later, she reported that her pain was significantly less. She had cut her ibuprofen dose from 24 to 3,600 milligrams a day to 1,200 milligrams a day, and her pain level is now a 5 out of 10. In addition, she reported that she was feeling more energetic, 6 on that 1 to 10 scale, and that her depression was better, now scoring a 12 on that 27-point scale. At that time, I also asked her to increase her physical activity level and to start a detoxification program, which included the addition of certain foods to her diet, things like fiber, green tea, broccoli, spinach, blackberries, and some nutritional supplements such as milk thistle and N-acetylcysteine. And when she came back to the office another 4 weeks later, this is now 7 weeks after her initial visit, she reported that her pain was virtually gone. She was only taking the ibuprofen 3 to 4 times a month. Her depression was also virtually gone. She scored a 3 on that 27-point scale, which qualifies as not depressed, and her fatigue was gone. She was reporting an energy level of 8 out of 10. In addition, she felt as if her mental function was improved and that her asthma was somewhat improved as well. So this story, I think, demonstrates the real power of naturopathic medicine, that very simple dietary interventions can have dramatic impacts. And most often, it affects a wide range of complaints, not just one single complaint, such as Colleen's arthritis. To give you a brief introduction to arthritis, about 50 million Americans suffer from arthritis, and the most common form of arthritis is known as osteoarthritis. This is the result of a lifetime of wear and tear in the joints, where the cartilage of the joints degenerates and results in pain and inflammation. And the most common treatment for this form of arthritis by conventional providers are things called NSAIDs, non-steroidal anti-inflammatory drugs. Things like aspirin, ibuprofen, Motrin, naproxen, and many others. These medications are very effective at relieving pain and inflammation, but there's a price for that, in that the most common side effect is damage to the stomach and the intestinal tract, resulting in sometimes bleeding and even death. In fact, it's estimated that 16,500 Americans die every year from the appropriate use of these medications. That's the downside of medicines like that. They're only going to help with the pain. They're not going to help with other complaints like fatigue and depression, and they have sometimes significant side effects. Now, in terms of the natural treatment of arthritis, there are really 4 primary things that I focus on to begin with: identifying food allergies, addressing blood sugar problems, using glucosamine sulfate, and balancing out the inflammatory pathways in the body using omega-3 oil such as fish oil. So I'll start by describing food allergies. Now, most people, when they think of a food allergy, think of someone who eats a peanut and then can't breathe immediately. And that's a pretty dramatic form of food allergy, but it's relatively uncommon compared to the delayed hypersensitivity reaction that can take hours to occur after you eat the food, and can cause a wide variety of symptoms, including things like joint pain, asthma, stomach aches, headaches, runny nose, ear infections, and a variety of other things. And these complaints can be quite severe sometimes as well. There are 2 accurate ways to try to determine which foods that someone is allergic to. One of those is to do what's called an elimination diet. You eliminate the most common allergens completely for a few weeks, then you put them back in to see what happens. It's free, it's very accurate, but it's quite a bit of work, and you only find out about the foods you eliminated. You don't find about anything else. So there are some significant limitations to that approach. The second option is to do a blood test. The nice thing about the blood test is we typically check 100 or more foods all at once. And so we don't have to worry so much about missing foods. And it's much, much easier for most people than an elimination diet because you get a list of foods that you're allergic to and that's what you avoid. And it's usually a much shorter and easier list than with the elimination diet. And this approach, in point of fact, is, in my experience, is what works best for most people. And if you'd like to learn more about food allergy testing, you can go to my website at www.greenmountainhealth.com, and there's quite a bit of information on there on food allergies as well as food allergy testing. Now to go on to blood sugar problems, and this was the case with Colleen, as you may recall from that description. When blood sugar is not well regulated, it can cause things like fatigue and depression and inflammation, and arthritis, as I mentioned, is an inflammatory disease, as well as things like weight gain and a variety of other mood problems. Sometimes you'll see problems with cholesterol and blood pressure and even high blood sugar, as in diabetes or prediabetes. The name of the game to better regulate blood sugar is to really cut back on the foods that spike the blood sugar, things like added sugars and grains and potatoes. These foods, by the way, are not foods that humans evolved eating. Concentrated sugars, grains really weren't in the diet until the last several thousand years with the advent of agriculture. So they're not foods that our bodies need. They're not foods that our bodies are well adapted to eating. Third would be, I mentioned cod liver oil or other sources of fish oils, omega-3 oils. These oils are known as essential fatty acids. They're critical nutrients that our body needs, and they're precursors to things called prostaglandins. Now, prostaglandins are compounds produced by the body that can either be pro-inflammatory or anti-inflammatory. The type of prostaglandins that are produced from these omega-3 oils are anti-inflammatory. And in addition, they block the production of those inflammatory prostaglandins, whereas things like saturated animal fats are precursors to those pro-inflammatory prostaglandins. In addition to the effects on inflammation, these omega-3 oils also significantly reduce the risk of heart attack and stroke. They can be very helpful with mood problems like depression, and they're very good for the skin and immune function. So they do a lot of things for the body, and really everybody should be taking these oils in some form or another. And lastly, in terms of natural treatments, glucosamine sulfate is something that I use quite a bit that can be very effective. Glucosamine sulfate is a precursor to the cartilage in the joint. So I mentioned that with osteoarthritis, the cartilage degenerates. Well, the glucosamine sulfate helps to prevent, and in some cases even reverse, that degeneration of the cartilage. And so it can help with the pain and inflammation that the arthritis causes. Now, glucosamine sulfate doesn't start working right away when you take it. It takes 3 to 6 weeks to really kick in and start working effectively. But most studies have found that it gives comparable effects to things like ibuprofen. It just takes longer to kick in and start working. So if you have arthritis and would like more help or need more information, feel free to go to my website at greenmountainhealth.com. And there you can schedule an office visit. If you're not able to make it to our offices in Vermont, we can do phone or Skype-based consultations anywhere in the world. You can also order a food allergy test, and we send out a monthly natural health newsletter with some of the latest information on natural health. Then you can sign up for that newsletter as well. Thanks for listening.